Life gives us great moments with our family and friends. Medicare benefits allow us to get proper care to keep enjoying these moments. But choosing the right plan and benefits can be confusing. With so many choices, you just don't know what to do. That's why I called Espis. They helped me choose a plan just right for me. Call 1-888-988-8072 and let one of their health plan advisors find the right health plan for you. Call now. One call does it all.
That's right. Welcome back to Sacramento and Company. You just saw it there. South Bay Health and Insurance Services, Espis, is an insurance agency with highly qualified professionals trained and certified to represent various health care products. Now, Pat Salas is here this morning to share more about the Medicare Advantage annual enrollment period and help us sort out what can be seen as definitely a complicated process. Pat, we were talking, thanks for being here, and we were talking a little bit there during the break. Can be very complicated for some people.
Very complicated.
Luckily, Espis is here to help. So tell us, what is Espis first of all?
Espis is South Bay Health and Insurance Services, as you said. We're an insurance agency that assists people with Medicare or Medicare and Medi-Cal to choose the plan, be it a Medicare supplement, a Medicare Advantage plan, or a prescription drug plan that best suits their needs. You know, each person's different, each need is going to be different.
Absolutely, yeah, and I would assume a lot of our viewers are on Medicare, or at least getting to that position. There's something coming up called a Medicare Advantage annual enrollment period, right? Are we in that now?
Correct. We're in that now. It started the 15th of October and it ends December the 7th.
Okay.
This period is very important because it's the one time per year when people can choose what's best for them. They can figure out, okay, I want to stay with the plan I have now. I want to change my current plan because I want to save. I want different type of coverage, etc. They can drop what they have now. They can add prescription drug coverage, or they can return to Medicare fee-for-service with no additional coverage, which is not a good recommendation, but they could also do that during this time.
And that's something you help people navigate, you help them learn. You were even telling me that in this region, people just don't have the knowledge.
They don't, and I think it's something that we've learned. We're from Southern California originally, and now we're very happy to be in Central California with 2 new locations. But what we've learned is Medicare Advantage plans, which are the HMO products and PPO products, are heavily advertised and marketed in Southern California. So the typical senior is very aware of them and knows to shop around during annual enrollment period. When we visited some of the seniors here, and these were people with very, very limited means, they said, I have a Medicare supplement, and maybe they were paying $150 to $180 a month. They did so even though it affected them financially, it affected their access to cash monthly, because they didn't know they had other choices. And they need to know that during this period, if you learn, if you get educated, if you access the tools that are readily available for you, you'll be able to make the choice that's best for you and have the proper coverage next year.
Oh, and so important for that to, I mean, right, it's scary to think when people, they don't know their options, and so they're just left out there hanging. I know there was a rumor, I didn't start it, I promise, but a potential rumor, Anthem Freedom Blue plan, is that what it was called? It's no longer available, but you have some more information to help clear that up.
Let me clear that up. Anthem Blue Cross had a product here that's called the Freedom Blue PPO.
Freedom Blue.
It was a PPO product that allowed people to go to different doctors, and it was very popular. They gave notice to the patients who have been affected, to those members of theirs that have been affected, as well as to us, the agencies that have sold it, to let us know that in many counties they would be pulling out. So Sacramento's been affected. They have a replacement product here that's more expensive now, but it's a replacement product, so we need to help them. If you know of anyone or you're someone who's been on that product and you received a letter letting you know that you need to make a new choice, then by all means please contact us, because a lot of people were affected.
They were okay. So the Freedom Blue plan, if they were on that, you're the perfect person. Your group.
We're happy to help them. We can give them in Sacramento, for example, there's a replacement product that we can put them into. If they don't want that replacement product, then they need to choose something else, whether it's a Medicare supplement at a premium or a Medicare HMO that's available, or whatever it is, we can help them.
That's excellent. How do people get more information just generally on what you're doing, how you can help, and how they can really...
Information is readily available in many places. Obviously, Medicare.gov has a lot of it, but in our case, we have 2 physical locations, one in the city of Stockton and one in the city of Modesto, and we truly believe in educating our seniors. So within each one, we have a classroom, and it's open every day from Monday through Saturday at 10 a.m. We do a benefit comparison for that county. That's Stanislaus and San Joaquin. For Sacramento, we have agents that are here every day that run in home. So they'll go to the home of the senior, and they'll compare their benefits, and it's important to mention that all of our services are free of charge.
Oh, that's excellent. If you were to give a tip to our Sac & Co viewers that aren't necessarily in the Medicare kind of world, but maybe know someone who is, what is it you're telling? If I'm going to tell my grandparents, my lovely grandparents who are probably watching right now, what do I tell them? What's the first thing I should
The first thing
tell
is,
them?
what kind of coverage do you have in addition to your Medicare? And they're going to tell you, oh, I have this type of plan. If you're a family member, please get involved with those seniors that you care for, like your grandparents, and find out what else is available. If they tell you, I don't know, or I don't have anything, red flag.
Okay.
Immediately say, well, let's go through this and let's make sure you do have some additional coverage to your Medicare so that you're not financially exposed. Let me give you an example really quickly. If they had Medicare only and they were to have a catastrophic event like a heart attack and they were to be placed in the hospital with no additional coverage, they would be responsible for deductibles. They would be responsible for a percentage of charges, and they probably won't have prescription drug coverage. So it's bad, and it can definitely affect someone financially.
Absolutely, and affect our whole family. So that's great. That's great for me, and I hope great for our viewers at home watching. Thanks for coming. Well, I know we want to put up some information so that people can very easily find you. There it is. You can call that the numbers you see on the screen. The different offices, one in Stockton, one in Modesto. You can hit them on the website. You could call that number, that 888-988-8072 for more information. ESPIS. Thanks for all the work you're doing, Pat.
A real pleasure.
Keeping our old folks, our old lovely folks, safe and all hooked up. So we appreciate it.
We'll take care of them.
All right.
This segment was paid for by South Bay Health and Insurance Services.